Welcome to our pamphlet series.
This video will expand upon the information on the pamphlets.
You can find these pamphlets in different clinics around town, and also you can download it from the description of the video below us.
Hello, today we will discuss about the shoulder and shoulder acute tendinopathy. Moshe, what is acute tendinopathy?
Well, if you have a diagnosis, if you've been a doctor, you might see the word tendinosis or tendinitis or tendinopathy. It's all represent basically the same condition.
Right.
Firstly, it's the number one reason for shoulder pain. That's
Right.
I think it's by far the number one reason for shoulder pain. That's an inflammatory condition of the tendon. Tendon is a unit that connects between muscle and a bone. It's the one that's responsible the transfer of force. For example, when I'm doing this, then my muscle contracted, and the tendon is the one that's responsible for the movement, to transfer the force of the contraction of the muscle to the bone. In many cases, either from repetitive movement, for example, people that work in what we call overhead activity, electrician, technician, mechanician, all the people that work a lot with the hand like this, or a barber that have to always be with the hand like this, they develop an overuse injury that the tendon is get inflamed from repetitive activity. It can also come from one-time aggressive movement. You try to lift something very heavy and you felt sharp pain, or sometimes even hear a popping sound in your shoulder, and then right afterwards you'll notice that you have an inflammation. Maybe you'll tell us a bit about what are the symptoms.
Right, so what you're going to get after this popping, or a couple of hours after that popping feeling, or that the starting of the pain, is a limited ability to lift your arm, especially on the side here, towards the side. You're going to have some acute pain. Now, it could be constant, even when you're at rest, or it could be that only when you're at rest, like this, would the pain be relieved. Now, it will be accompanied also probably by pain when you touch, but the most common is lifting to the side and not being able to because of pain right in this area here. So what should we do when you have this acute pain?
Well, when we're talking about acute pain, firstly we're talking about the first 5 days to a week following the injury. In this phase, our goal, almost our exclusive goal, is to protect the damaged area and not to increase the damage. So even in the worst cases, in the very severe cases, I would recommend to use a sling for a few days. Again, I'm emphasizing that it's only in the first few days, using of a sling to give the hand some rest. Secondly, and it's avoid any activity that aggravates the pain significantly, like overhead activity, lifting, carrying. If you do an activity and it's not painful, that means that you can do it. In this case, we will listen to our body, as we said, and we'll listen to the pain reaction. So in this case, we will reduce our activity level, especially to overhead activities. Ice can help. 15 to 20 minutes ice pack around the shoulder.
And if you saw your doctor, anti-inflammatories, again, only in that first period between the 0 to 7 days.
Of course, one more thing that is very important is to do movement in the area around it. For example, the wrist. So try to grip, try to move the wrist, try to move the elbow to straighten and bend. Move the neck area, even the shoulder blades, if it doesn't cause too much pain. And one more thing, as I said, it's a muscular problem, which means that usually, except from the first 2-3 days, it will be painful when the muscle need to work. But if we'll do the movement passively, like I'll demonstrate, if I'll move your hand, it shouldn't be too painful. It might be very, very mild pain. And in this case, I will also recommend an exercise of trying to grab one hand with the other hand and try to lift it, even every hour or every 2 hours, just 2 or 3 repetitions, just so we can keep a range of movement. But again, only if it's not painful.
Right. Right. The idea is movement is very important, but without pain.
Obviously, everything is changing after a week when we move to what we call a subacute condition, and then we have our goal will be to strengthen the area, the injured area, gradually, and you can talk about it a bit.
Yeah, so the strengthening exercises ideally should be prescribed to you by a physiotherapist or someone who is a specialist in exercises. What we will do is give you a progressive strengthening program, something you don't have to come back to the clinic to do every time, something we could teach you in a couple of sessions to do at home. It's a progressive loading of your tendons, and that loading will make it that the tendon the muscle will get stronger, control your shoulder better, and prevent a relapse of the condition.
Okay. Now one more thing that it's important to state is when should we really seek for medical help, because let's say that we lift something heavy, we felt pain in the shoulder. Should we rush immediately to the emergency? I don't think that it's always the best decision. But firstly, I would be concerned if it's something that's happening on the left side, especially if you're in the age to get a heart condition, or if you have history of chest pain or condition with your heart, so it's definitely something worth screening. Another thing is that in many cases the shoulder pain comes from the neck.
Mm-hmm.
In case that you feel tingling and numbness along your arm, especially if it's below the elbow, usually shoulder pain will extend all the way to the elbow, but it won't go below the elbow. So if you have tingling or numbness or symptom like this, or if you're extremely weak, then I would definitely recommend to seek for a professional help, either your doctor, walking clinic,
Mm-hmm.
physiotherapy, someone professional that will see you to make sure that really the only problem is the shoulder. If the only problem is the shoulder, we also have a variety of exercises in other videos in our website that
Mm-hmm.
the patient can consult with.
Okay.
Enjoyed our video?
Please like and subscribe to our channel.
Thanks for watching.